Good morning, everybody. We are here with Lilia de la Garza from the Council of Alcohol and Drug Abuse of the Coastal Bend, and she is here to talk with us and help us get more informed about fentanyl awareness and what we can do to help our kiddos and students, help us be more aware and help our students, our children and kiddos. And so I'm going to turn the microphone over to her
Thank
and let
you. Welcome. I am Lilia de la Garza. I work for the Council on Alcohol and Drug Abuse of the Coastal Bend. I've been in the prevention field for over 20 years, and so we've seen quite a bit of trends and different types of drugs that have kind of fluctuated over the course of the last 20 years. And fentanyl is one that's been creeping and crawling up. More recently, there's been so much more use of fentanyl, and we see a lot of abuse when it comes to fentanyl as well. So, today we're just going to be talking a little bit about that. Um, I just want to give you guys some awareness. So, a little bit about us. We are one department within the council. Our program strives to strengthen and enhance youth life skills in hopes of preventing the use of alcohol, tobacco, and other drugs. We do provide a curriculum. There's times where we go to different campuses in the Coastal Bend. We also do activities. We do presentations. And the topics can range from substance abuse to dealing with stress, right? So specifically today, we'll be talking about fentanyl. All right, so fentanyl is it's a potent synthetic. It is approved by the FDA for use for specifically to treat pain. Generally, they will use other drugs first, but if it's something that's really severe, like they just got out of a surgery or they're dealing with some severe chronic pain, fentanyl is an alternative that they can prescribe. It's about 100 times more potent than morphine and 50 times more potent than heroin. But what we're seeing is just a little tiny grain is a lethal dose. So that's only just 2 milligrams of fentanyl, which equals to about 10 to 15 grams of table salt. It's being produced illegally and it's being distributed. So we know that fentanyl is something that's making its way into our areas, and it's important that we provide awareness. So how does it work? Well, it latches itself to the pain and emotion receptors in your brain. So, you have tiny little receptors, and those receptors are firing off. When a person feels the pain, those receptors are, showing that there is so much pain going on. The fentanyl latches on to those receptors and kind of calms them down, shuts them off. And unfortunately, because it's so strong, it's so potent, that when a person is abusing it or they're misusing it, it can also cause other things to shut down, like other organs, including the brain, the heart, and the lungs. So we know that when your heart stops working or your lungs stop breathing or your brain stops functioning, you're not alive, right? So you're either brain dead or your body's not breathing, your heart's not pumping, you're not alive. How's it being used? Well, it is generally a pill. It's used, like I said, to treat specific illnesses. It can be used as lozenges or patches. They can give it intravenously through a shot. However, those are all ways that they can use it through prescription, right? So if they were in a hospital or they were prescribed that, they can give them in a patch. But it can also be snorted or sniffed in a powdered form. It can be smoked. It can be used in a nasal spray. It can be put into candies. It can be spiked into blotter paper. Um, it can be sold alone or in combination with heroin or other substances. And so one thing that's coming up and here in the next few weeks will be Halloween. And I recently did a presentation for a superintendent who is really adamant that we talk to parents about how this can look like candy. And so we make sure that if your children are out trick or treating, that you're making sure that you check the um, the candy that they're bringing in because it can look like candy. Now, do I think that someone's going to intentionally go out and try to give fentanyl to a child? I don't think so, but that doesn't mean that it can't happen, right? It's certainly possible. It has also been identified in fake pills or mimicking prescription drugs like oxycodone and has also been used in a liquid form. So the reason why the liquid form is important to realize or really think about is because there are products out there that do use a liquid, and we'll talk about that here in a second. So it's not just a vape, right? There's a disturbing trend that it can be used in vape devices. So that's not something that's been identified here in Nueces County. However, there have been other cases popping up, in Texas and in the country. So be aware that kids, legally cannot vape. However, it's important to really recognize that if someone is vaping, they're caught vaping, you quite frankly don't know what they're vaping. It doesn't necessarily say it unless it's a purchased product, that has the name brand. And some products out there can even have a name brand that they purchased online and they can be refilled with, other liquids, right? So um, even vapes can be a carrier or can be a mode that they use fentanyl. So can you tell the difference between a fake or authentic drug? Right? So I guess that's the whole point because we really don't know if someone brought something and we know that it's against school policy and it's illegal for someone to bring medication in their pocket to school. But if somebody brought something and said like, oh, my mom takes this because she has a really bad headache or she's using it to deal with anxiety, and someone says, well, I don't feel good, and they say, here, just take one of these. Can you really tell the difference? So which one of these is a fake pill? And you could just put it in the chat. Is it A or is it B? What do you guys think? Anybody? B. Okay. So you were right. Ding, ding, ding. It is B. It is B. Sorry. The other answer was incorrect. How about this one? Which one do you think is the fake pill and which one's authentic? A or B? Just tell me the fake pill. The fake pill. A. All right. And then B. So the fake pill is A, right? So they both look pretty. I mean, B looks like because it has the Xanax on it, it looks like, it's actually authentic. But then it could go the other way because A looks pretty well manufactured, right? So let's do the third one. Which one of these is the fake pill? A or B? A and A. Okay, you got it. A is the fake pill, right? So the point I'm getting to is it is kind of hard to tell. In reality, a lot of these pills, they look exactly like the authentic pills, right? And so when we're talking about, something like fentanyl, um, versus, something that maybe they made illegally or illicitly, and they're passing it off as Adderall. Um, if it looks like it, somebody might not even know the difference, right? So, we need to make sure that our kids are aware not to take anything, not even if they know what it is, because you really don't know what it is. because it really looks a lot like the other, the other medication. Plus, we shouldn't be taking anything that doesn't belong to us anyway. And also keep in mind that take a look at the number 30 and the other one was 20. Even though, they were making it illicitly, they even got the milligrams differently. And you can, right? Because they're making it however they want to. So there is a public safety alert right now. The laboratory testing indicates 7 out of every 10 medications that they pull in by the DEA contain a lethal dose of fentanyl. 7 out of 10. So that means an astronomical amount of fentanyl is being confiscated. DEA seized a record number of 79.5 million fentanyl pills in 2023. That was last year, right? Which is already exceeds the year before's total, which was 58 million. So in 2022, they got 58 million. In 2023, they got 79.5 million. Right now, the DEA has 4,500 pounds, which is 33 million pills. Okay. So far, and I want to say that number is probably, we're in October, that's probably number September, maybe a July number, because they're always behind, right? They're trying to keep it up to date, but it's always behind. So maybe July. So January, February, March, April, May, June, July, a little bit over half of the year, they're already at 33 million. So that's pretty scary. How does it affect the body? Well, similar to other opioids, fentanyl affects are they relax, right? They attach themselves to those receptors and they shut them down, so they calm the person down. They feel a little bit, euphoric, like they're, kind of high, loopy. It relieves their pain, obviously, because it is a pain reliever when it's used as a prescription. It is a sedation, but it also causes confusion and drowsiness if they're operating a vehicle. So they really shouldn't be operating any vehicles. They can be vomiting or nauseous. They are not able to have, they have urinary retention, constricted pupils. But here's the scary thing. Then it can also slow breathing and stop breathing. So that is the big ding, 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 ding warning sign when a person is using fentanyl, because it can, it can slow down the breathing, slow down the heart rate and their breathing. And then eventually, if it continues, if they still have too much in their system, then they can stop breathing, right? So what are some signs of an overdose? It's important that if you know someone, even if they were taking something that was prescribed to them, sometimes people don't always use their best judgment when they're dealing with pain, and they maybe feel like they're still in so much pain. They already took the medication, but now, I'm going to take another one because I just can't take it anymore, right? So they can overdose even if it's a prescribed medication, right? It's just the person really needs to be careful on how they're taking the medication. So what are some signs of that overdose? They have smaller constricted pupils or pinpoint pupils, extremely pale. They feel cold, clammy to the touch. They may have like a purplish or gray look. Their body is limp. Their fingernails and their lips, they're all turned blue or purple. Right? That means that they're not getting oxygen, right? That's telling your body, that's telling the person on the outside who's looking at them that there's no oxygen, not enough going to the fingertips. That means their organs are also probably struggling too. Vomiting or making gurgling noises. They cannot be wakened, or they're unable to speak. So sometimes they may look like they're like catatonic, like they look like maybe they had a seizure. Their breathing and their heartbeat slows down or stops. So make sure that you are, doing some things to help that person. So if you notice any of these signs, first things first, call 911. Try to wake the person up. Naloxone is available if the person is more than likely, abusing. It's a good idea if they have naloxone. It is life-saving. Begin rescue breathing. CPR, turn the person on their side to prevent choking, and stay with the person until somebody arrives, until the ambulance gets there, EMTs are working on them. So there's a little bit more about naloxone. Actually, naloxone or Narcan can be used. It's just a little nasal spray. It's it's very readily available. A person can get it at pretty much any pharmacy. It's not very expensive, less than $50 for a 2 pack, so about $25. And again, it can be life-saving, right? So even Walgreens, HB, CVS pharmacies, those carry it. I know I actually saw one, and I don't think I thought I took the picture, and I don't think I entered it to this, but I saw one at the HB pharmacy, and it was like right on the shelves right next to where you drop off the medication. And they didn't have the box, they just have like the paper where like a barcode where you can just grab the paper and take it to them and get it. Um, but it's like I said, it's pretty readily available and it can be life-saving. So there's a campaign right now that's called the One Pill Can Kill. There are so many young people who are um, falling to fentanyl, and they've lost their lives. So a lot of times parents and family members have entered their information, put their stories out on this campaign. So fentanyl poisoning is happening to teens right here in Texas. Um, we have to start talking about how to stay safe and learn about prevention strategies. So what do you do? Like, how do you talk to kids about fentanyl? What's appropriate? What do you talk about? What do you say? So whether you want to inform your child of the risks or are concerned about a loved one who is used, it's time to talk about it. Um, Make sure that you're doing your own research. I'm giving you information today, but don't take my word for it. Do your own research, look through your own sites, but make sure they are credible sites. We want to make sure that we're looking at sites that are evidence-based, that are, backed by science. Right? There's a lot of misinformation out there. Stay calm, be direct. Our kids, they know a lot more than we give them credit for. So be direct. Don't be afraid. Don't think that you're going to be giving them an idea that they've never heard of before because they probably already know about it. Ask questions. And when you ask those questions, be willing to take the information. Sometimes we don't want to hear the answers. We want them to hear us, but we're not willing to hear their answers. So be open-minded about it. Don't judge them when they tell you, whatever it is that they're telling you. And then be willing to work together to come up with a plan that's going to help them stay safe. Here are a few resources for help. Padre Behavioral has some information. They have some resources that are readily available. These are resources that are local. Corpus Christi Medical Center, that's their phone number. Our council, we do have counselors that are available to anybody who wants to come in. Oftentimes we'll have a parent and they might bring their teen, or if they went to court, they might be referred to our program. But we do have people that are here available at our location to talk to young people about what's the next step. So make sure that you are talking to them about helping them get that help that they might need. These are the sources that I used. Again, I try to use all credible sites, the DEA sites, the state sites, the fentanyl site. And that is my presentation. I know that it was pretty quick and short, but it was pretty much to the point. Does anyone have any questions? And if you don't have a mic, you're welcome to put it in the chat.
If we have questions that arise after this, and they contact me, they can contact me, M.
And then
Fowler,
you could just forward
and
it
then I
to me
can
if you
forward it to you. Yeah. So if there are any questions, M. Fowler at calallen.org, and I can forward it to Lilia.
And on that, just one second, I'm actually going to stop share for a minute because I want to share with you guys one more thing. Stop share. Okay. Just, if you just bear with me for just one moment, because we do have a we do have an event that's coming up that would be a great event for people. We have the prescription take back medication event. It is going to be hosted at our location. Okay, let me see if I can share that now. Just one second, because it didn't open. Let me try a different one. Just one second. Sorry, I should have pulled it up, but I didn't. And let me try to share it again. I bet it's not going to share because it's it says the window is invalid, but maybe I can add a it's not online yet. So I guess I can just forward it to you, Miss Fowler, and you can attach it on there if anyone is interested. But we are going to be hosting our take back event. It's basically anybody can come drop off medication that's unused. Keep it out of the hands of people that they can be potentially dangerous for. We're hosting it on October the 19th. I'll just put on here, take back event, October the 19th. From 9 to 1 p.m. at 1801 South Alameda. It's going to be at our location. We are at the 6 Points location, Council on Alcohol and Drug Abuse. And last year we were able to turn in like 500 pounds of unused prescriptions that people were able to, get off the street, because, if you have them in your kitchen cabinet or your restroom cabinet or whatever, anyone could come over and take that. And, that could be potentially somebody overdosing on something that shouldn't have been available to them anyway. Right. So please take advantage of that. You are welcome to come by. We are at a 6 Points location. We're the Council on Alcohol and Drug Abuse at 1801 South Alameda on October the 19th from 9 to 1. We will be out there. We will be taking as much prescription drugs that are unused as possible.